Welcome to Diabetes Education 2, the second in the three-part series. The new generation of healthcare education. Currently now, diabetes education is provided in a doctor's office setting. Unfortunately, most doctors do not have the time to give you the type of education that most patients need. Most office visits are only scheduled for 15 to 20 minutes, and rarely do patients get all of that time. And there's so much information to discuss. Diabetes is a complex subject. Making diet, exercise, lifestyle changes are difficult, requiring a lot of teaching and encouragement. Currently, our system is also very provider-centered. It's lecture-based, and the old style of educating patients in the office is way too time-consuming. Very few medical practitioners will do it. It's also a poor way to improve patient success. Our old system doesn't work. We need to change the approach to diabetes education. So the future of diabetes education is informative videos. The best is interactive, with motivational interviewing on a one-on-one with a medical practitioner who understands diabetes, diet, education, right there, one-on-one. And motivational interviewing is a learned skill by a practitioner and is invaluable in the practice of diabetes education because making lifestyle changes is very difficult. For a medical practitioner to just say to a patient, you need to lose weight, you need to change your diet, is incomplete and insulting. You should hopefully find a medical practitioner who understands motivational interviewing, which is a way to help people make difficult lifestyle changes. I intend to set my patients up for success. Motivational interviewing is designed to elicit change talk. As you watch the video lessons on this website, make note of the questions that I ask you and attempt to answer them. Allow patients to choose what behaviors they want to modify. A patient-centered approach to healthcare is the patient is driving the car and the practitioner is just reading the roadmap. Repetition is key to learning new information. Watch the video lessons more than once. You will retain more information. This will arm you with the basic knowledge to which to build upon as you make decisions on how to improve your health. You have to figure out what's going to work for you. And website-based learning is excellent. So watch these video lessons at your leisure and in the privacy of your own home. Telemedicine, which is a way of interacting with a patient via email or video, is a form of communication which will be used more and more in the future in healthcare in an attempt to be more in touch with patients. Getting your diabetes education on this website values your time. For many patients, it is too difficult to come to the doctor's office on a frequent basis, just to be told that you're not following the program, you're not taking your medications, you're not exercising, you didn't change your diet. Insulting. Motivational interviewing techniques have been proven to improve patient outcomes in an attempt to get patients to prioritize what is most important to them in their lives, and to be guided in how to tweak your eating patterns or incorporate a little bit of exercise to improve your health. And the step approach is best when making changes. You got to take little bites. So go armed into your next office visit. Insist on getting what you need from your time with your medical provider. Getting valuable information that is evidence-based and setting an agenda about what to discuss during an office visit will make the most of your time together with your provider. So you should ask your provider how best to make the changes that they're asking you to make. So if they were to say, I need you to change your diet, say, be more specific about what changes I need to make. What foods am I currently eating that are causing me to have more health problems as I get older? And what foods should I be eating? If they tell you you need to exercise more, say, can you be more specific about how I need to move more? In what manner? These are the questions that need to be asked and discussed during your medical visits. You need to ask for bias-free education based on evidence-based research. Too many medical providers do not keep very current with the newest research available, and things are always changing based on new research. One example is the low-fat diet craze from the 1970s and 80s, and this is still held as a common belief. And what does that mean? It's axiomatic. And this is held as a common belief among patients and medical providers. However, this is wrong for human beings desiring a healthy diet, and was wrong from the beginning. Unfortunately, it was a widely held belief based on one flawed study. And if you've seen my Be Careful video lesson, you will understand what I mean. So the next video lesson for diabetes education, the third in the series, focuses on what happens in your body if you have blood sugar imbalances and how to change that without the use of medications or minimal medications, and how to maintain your success in avoiding type 2 diabetes. Please tune in to more video lessons. I'm Christine Olivieri, your paleo practitioner.